Well, a hearty hello and greetings to all of my friends and colleagues, and I'm really glad to be with you today with the American Acupuncture Council Facebook Live presentation to always provide you some updated information, make sure you're always on top, and what a great way now that we can disseminate information to make sure we've got a practice that's doing well, that we're all working as a team. And that's what the American Acupuncture Council is about, is making sure that you're having a profit. We're your team member. We're part of your team. Without you, we don't exist, and we want to make sure that you do very, very well. So greetings again and welcome, and let's get started with the slides today. And I want to start with just making sure everyone can see my email, but also the American Acupuncture Council logo, know where you're at, and kind of give a mission statement. I always say our goal and commitment is to strengthen and grow the acupuncture profession by providing education, tools, and support that continually improve productivity, but also keep you updated. Well, one of the areas we've been running into a lot of problems is the use of E&M codes, evaluation and management, or exams. So let's start with, though, the real basis behind this is that, of course, an acupuncturist can perform an exam, and thanks to parts of the Affordable Care Act, specifically the non-discrimination, it says that you cannot be discriminated within scope of practice. Now, certainly, many of us have issues with the Affordable Care Act on many levels, but there was one good part, and that was non-discrimination. As I'm sure you're aware, insurance companies can no longer discriminate within scope of practice, meaning they can no longer say we pay for something only to an MD. They have to pay it to an acupuncturist if it's within scope, and they pay to other providers. So this rule has been really helpful. In fact, here's what the law says. I've highlighted in red. It says any insurance offering individual or group insurance. So this really means all. And I'll highlight here where it says coverage shall not discriminate with respect to participation, meaning all plans have to allow acupuncturists as part of it, but also who is acting within the scope of license. And now scope of license simply means something that's within scope, whether it's exams or, of course, going to be acupuncture itself. So now let's show where this has come apart or come to. And in fact, I think it's important to see this. This is the Blue Shield of California payment policy. Now you might say, well, I'm not in California. What's important to note is that the reason this policy has changed this way is because of the Affordable Care Act. And I want to highlight something that I'm sure most of you are aware of, but that the lack of discrimination. So I'll point you to in the policy here, you can see when the revision date was, but take a look here under the application. It says Blue Shield of California's acupuncturist payment policy will apply to all professional services performed by an acupuncturist that are within her or his scope of license. So in other words, they have to pay within scope. Now you again may say, well, I'm not in California. Well, this law still applies in every state. So scope. So here's the point. Notice effective. Blue Shield of California will pay for evaluation management services, and note every single one, 99050 to 99499, that are within scope of license. So bottom line is what this is referring to is that you can't be discriminated, and it is appropriate for you to bill an exam or an evaluation and management. In fact, how would you not? How do you determine what's wrong with the patient without doing an exam? So let's take a look at what these codes are. And this is the issue I want to get to. We have two types of evaluation and management. And when you hear the term evaluation and management, we often think of it being an office visit. And I want to kind of change that mindset a bit and bring it back to say it's not just an office visit, but it's two things. It can be evaluation or management. So think of it as two things. It's the examination or potentially counseling, but above and beyond the norm. So let's go into the codes themselves. Of course, here's a new patient code, 99201 to 99205. That's a new patient, meaning someone you haven't seen before at all, or you haven't seen within 3 years. So realize a new patient is not necessarily someone who's brand new, but someone you haven't seen in 3 years. But it also doesn't change by having a new injury or a new condition doesn't change a new patient. So it's certainly appropriate to bill an exam of a patient that's coming in the office to determine what's wrong, take a history. The next code that we have is for established patient. Now, defining an established patient is relatively simple. It's a patient you've already seen, already examined. So bottom line is any patient that you're doing an examination of, that's a previous patient. Within 3 years, you would bill these codes. Now, the area I want to get into here is it's certainly appropriate to bill an exam approximately every 30 days, sometimes sooner, but certainly every 30. The issue we're running into is that for whatever reason, there's some bad information floating around the profession where acupuncturists have been pretty much pushed to believe they can bill an evaluation management every single day. So I'm going to show you some examples here of where you want to be careful and issues we've run into, particularly in dealing with audits from the malpractice carrier, because I'm the billing expert that deals with them. So here's an example, and I'm going to highlight just this bottom area here where it says While we recognize the initial new patient evaluation management procedure is compulsory for a new patient in order to institute a plan of care, it goes on to say the use of an evaluation management of an established patient admitted with a 25 modifier has been deemed erroneous. In other words, this provider was billing an E&M every day. And it goes on to say, in order for an established patient evaluation management service to be billed, a separate and identifiable issue above and beyond the usual pre-service and post-service work associated with the acupuncture service has to be present. So in other words, the acupuncture code itself includes a day-to-day, how are you feeling? In other words, some pre and post-service work associated. In other words, on the first visit, when someone comes in, you certainly are going to spend a specific amount of time with them determining what's wrong, how they're feeling, doing a full exam. But on the return visit, you're not just going to tell them to shut their mouth and lay down and insert needles. You're going to ask them, hey, how's it feeling today? Is it better? Is it worse? In other words, a small interim history. So this is what this is referring to. We have to make sure if you're billing an E&M, we have to show it's above and beyond what we do normally as part of the visit. So on a day-to-day visit, not appropriate. First visit and re-exam, certainly the case. Here's another example. You'll notice this was an audit. This was from Cigna, and I'm just going to highlight. I don't want to get into the money part, but number one, an unsupported evaluation management service. It says in each of the 36 claims reviewed, the evaluation management code was billed in addition to acupuncture codes. The review of the clinical documentation provided by the practice indicated that these separate E&M services were not supported. So in billing an E&M, if you think it's appropriate to bill one every day, there have to be something above and beyond what you would normally see day to day. New condition, new complaint, new injury, things of that nature. So again, not appropriate to bill one day to day. And here's another one, same type of idea. And again, some of these have some pretty big monies, and this is why I'm nervous for the profession in doing this wrong. It goes on here to say there was a total of 5,139 occasions where Blue Shield was billed for evaluation management services, but on 383 of those, they appear to be the initial visit, so it's allowed. But then it goes on to say the remaining 4,756 were not, because they appear to be just the normal follow-up. So you can see here the amount of money they're wanting. So let's really kind of get into it and say, well, where does this come from and where's this bad information? I'm not sure, because here's what's included in acupuncture. The acupuncture codes, when you bill an acupuncture code on a follow-up visit, this is what it includes, called a pre-service, intra-service, and post-service work. So what does that include? Pre-service, before you even see the patient, it includes a few minutes or a moment or two of a record review of prior. When you see a patient, you don't just go in the room and say, hey, how do you feel? You're going to look last time and see where you're at, so you'll know where you're going. Then the second bullet here indicates a review of the chief complaint, interim history. In other words, how are you feeling today? When you left last time, the headache was better, so you're trying to get in the interim. It may include communication with other providers. That's not very common, but possible. But also preparations for care, setting up the table, getting the needles ready, washing your hands. Those things would certainly be part of it. And then there's the intra-service. Intra-service would be your kind of exam, if you will. Discussion of the service with the patient, evaluation and assessment, maybe tongue and pulse. Maybe you're doing a range of motion. Whatever style of eval that you do day to day would be included. And then it says performance of the acupuncture service. And realize that includes hand washing time, insertion, stimulation, removal, monitoring the procedure, and retention time, of course, does not count, but that certainly is part of the service. And then post-service work includes evaluation and discussion with the patient. In other words, you sit them up, make sure they're okay, no bleeding, nothing unusual, make sure they're comfortable. Then you may even document the service. You may give them some counseling about future needs. Maybe they should drink more water, maybe make about how their sleep habits are. In other words, there is a small evaluation and counseling included in the acupuncture code. And this reasoning is the sole reason why you bill a 25 modifier. So you'll see in this example, on this visit, you'll notice there's an exam code, 99203, and then notice right next to it in the modifier section is a 25. What that 25 indicates is that we're stating to the insurance carrier that this examination is above and beyond the day-to-day associated with treatment, hence to pay it. So that's the big reason we do the 25 is what we're doing here, and you'll see this in bold. It says a significant, separately identifiable service above and beyond the usual pre-service and post-service work associated or already included in the acupuncture procedure. So acupuncture includes a small day-to-day evaluation, and I want you to be very careful. You cannot bill one each day unless there's some condition or reason that's above and beyond the day-to-day. The accepted time frame might be as little as every 2 weeks, but certainly not more than a month to do a reeval, but certainly not one each day. And so you'll notice in this example, I have a new patient code 99203, but notice in the examples below here, I have 99203, a new patient or an established patient, both getting a 25. And what is that indicating? That it is above and beyond. Now, when you bill that very frequently, it's probably going to create a appearance that your billing is a bit unusual. Doesn't mean wrong, but unusual. Whenever your bills are unusual, providers are generally going to get requested for records. And when they request the records, doesn't mean you've done something wrong. So don't panic that a request for records means you're in trouble. It simply means they're verifying what was done. So in this instance, when they're getting a request for records because you billed a 99213 repeatedly, the request is because they want to verify that it was done and it was above and beyond. Remember, the day-to-day eval that you do is included. When you do a re-exam, it's clearly more time. You're really going to look at everything of how the patient's improving, but the day-to-day is not. Realize this is the same application for medical providers, for physical therapists, chiropractors, you name it. Realize all providers, when you're doing treatment, you cannot bill a separate quote-unquote office visit or exam because there's a certain inclusion. Note, even a medical doctor, if they're doing an injection, generally cannot bill an exam because there's an inclusion unless they go above and beyond. But most medical doctors, the reason they bill only an evaluation management is because that's all they do. They don't provide treatment, and they certainly don't see someone as often as an acupuncturist will. A safe bet would be if you're billing an E&M, certainly every 30 days, 4 weeks, there should be a non-issue, but it certainly can be sooner when and if there's an issue above and beyond the norm. So let's take a look at the acupuncture codes. You'll see them here. It talks about 9781014. We all know those codes in time, but I want to highlight, it talks about the 15-minute session. What does it include? And I want to highlight specifically here, it says, what this includes, it says this would include review of history, day-to-day evaluation, hand washing, choosing and cleaning points, inserting and manipulating needles, removal, disposal, as well as completion of chart notes while the patient is present. So in other words, notice all the things it includes, therefore, again, cannot bill one each and every visit. So I want to implore you, it is reasonable to bill an exam on the first visit and on re-exams, but almost never day to day unless the patient literally had a different complaint on each visit. Again, is that probable? Not really. Is it possible? Sure, but probability is low. So I want to be very careful. Don't get caught up. Just because an insurance pays it doesn't make it correct. It simply means they're assuming what you've done is correct, but later when they see a pattern that's unusual, when they request records, it's almost never something we can win because it's hard to prove there's something separate day to day. So exams can be done, but please make sure that if you're billing a re-exam or an office visit, if you will, it's above and beyond. This is what we teach at our seminars also, of course, and we do have a network for counseling. We do an AcuCode book. There's a lot of resources for you. So definitely take a look at the education arm of the American Acupuncture Council. It's the aacinfonetwork.com. There you can click on seminars, AcuCode. We're there to help, particularly this insurance information network. If you join that, it's something where you actually get to connect with me directly, one-on-one, in dealing with any issue as simple as I need a code to more complex issues of, hey, how do I document? How do I deal with it? We're really here to help. And I'm going to invite you all. We have a seminar coming up in Honolulu, Hawaii. It is a national seminar. It's obviously going to have specific information for our Hawaii providers, but anyone interested, this seminar is going to be on September 16th. It's going to include whatever state you come from. It's going to include the information. We have an early bird sign up for it, but I want to entice you because beginning October 1st, guess what happens? There's updates to ICD-10, and those new codes will be provided at the seminar to you, or if you have our AcuCode, they're actually already there. We want to make sure you have the most current information and making sure that you're billing properly, because the 2019 codes begin October 1st, 2018, and we'll provide them at all of our fall seminars. So you can look, we have dates all the way listed through next year, but we want to make sure you're up to date and doing well, because billing and coding is our business, and that's how you get paid. So I'm thanking you for spending some time with me. I do want to highlight that Lauren Brown, one of the best acupuncturists out there in my opinion, but also one that really deals well with business, will be your guest next week. or your host, and I look forward to hearing his information and each week for all of us. And again, thank you for spending some time. This is Sam Collins signing off.